Have you ever picked up a health information leaflet at a clinic or hospital? Did it really help you understand your health better? Have you ever found one so useful that you felt like sharing it with others and saying, you must read this? If not, you are not alone. Let's talk about why many of these leaflets fail and what we as health communication experts can do to fix that. If you are new here, my name is Dawood Mehrabi. I hold a PhD in mass communication with a special focus on health communication, and here is the Health in Simple Words channel. Let's have a definition of health information leaflets. These are short printed materials, usually just a page or two, that give us basic information about health condition, treatment, or how to stay healthy. We often find them in clinics, hospitals, pharmacies, and community health settings. They are supposed to make health information simple and easy to understand, to increase our awareness, to improve our health literacy, and to help us make a better decision about our well-being. But the big question is, do they really work? If you have ever used these leaflets, or if you are part of an organization that creates or distributes them to raise public awareness, this video is for you. Health literacy is one of the main goals of health content, including leaflets. Health literacy is the personal competencies and organizational structure, resources, and commitment that enable people to access, understand, and evaluate and use information and services in ways that promote and maintain good health. There are many effective tools and methods to improve health literacy, including health apps, educational video, podcasts, and radio programs, face-to-face consultation with professionals, media and social media campaign, booklets, posters, and infographics, educational text messages, online health courses, online support communities and groups, health information leaflets. To effectively increase health literacy, these specific strategies are essential. Clear communication, training healthcare professionals, utilizing visual aids, integrating technology, engaging community, supporting shared decision making, addressing social determinants of health, tailoring communication to individual needs, monitoring and evaluating any health program, intervention and plan, providing feedback mechanism, and promoting lifelong learning. While research on health literacy assessment is growing across the world, the implementation of systematic health literacy data and monitoring mechanism remains scarce. Although such data and mechanisms are important to inform the development of health literacy policy and practice, they are largely ignored when it comes to health information leaflets. Each year, substantial resources are spent designing, printing, and distributing health information leaflets. Once considered vital tools for public awareness, many of these materials now go unread and eventually end up as waste, not only squandering financial investment but also contributing to environmental damage through excessive paper use and printing. If we look at these leaflets from a health communication perspective and consider their effectiveness and the efficient use of resources, we need to acknowledge that communication patterns have changed drastically over the past few decades. Simply providing accurate information or raising awareness is no longer enough to influence health behavior. Over the years, thinking around health communication has evolved significantly. While accurate information remains essential on its own, it rarely leads to substantial behavior change. Earlier approaches, such as information, education, and communication, IEC, relied on a linear model of communication, mainly in health education. The simple transfer of information from sender to receiver. These were followed by behavior change communication, BCC, social marketing, SM, and social and behavior change communication, SBCC. Today, the term health communication encompasses all these approaches, aiming to improve health outcomes in a more integrated and effective way. In the current landscape, meaningful behavior change is the cornerstone of building healthier communities. It's not awareness alone, but actual changes in behavior that reduce unnecessary visits to healthcare facilities, allow professionals to focus on patients with real needs, and improve overall service delivery. To drive this transformation, we need communication strategies that are measurable, adaptable, and evidence-based. One of the biggest limitations of printed health information leaflets is their inability to monitor engagement or provide feedback loops necessary for continuous improvement. Today, nearly all individuals visiting healthcare facilities own a smartphone or provide an email address during registration. This opens the door to more targeted, personalized, and technology-driven communication. Once a health issue is identified, educational content can be delivered directly to the patient's device with built-in mechanisms for follow-up, feedback, and evaluation, all while maintaining strict privacy and data protection standards. While health information leaflets may still contribute modestly to individuals' health literacy, they fall short in creating lasting community-wide health impact. This is where health communication professionals play a critical role by optimizing resources, applying scientific thinking, and designing a smart, scalable, and sustainable strategies that truly improve public health outcomes. So, as a health professional, a healthcare organization, or an individual, what can we do? Let's move beyond producing content for content's sake. If you are a health professional or member of a health organization, design health communication materials with purpose, align them with behavior change goals, evaluate their real-world impact, and use those insights to better respond to the health needs of our community, because content alone is not enough. Impact matters. And to all of us as patients or readers, let's make sure we use health leaflets the way they are meant to be used, as tools to help us make better health choices and understand our care more clearly. And finally, if you find this video helpful, give it a like, share it with others, and subscribe to Health in Simple Words so we can keep bringing you clear, easy to understand health information that matters. Thanks for watching.